Hello, this is Dr. David Greene, CEO of the Washington Pain Network. Today's topic is what you need to know about spinal cord stimulator implants. A spinal cord stimulator is a revolutionary device that is permanently implanted around the spinal cord in an effort to provide pain relief to chronic pain patients. It works well for either chronic back, leg, arm, or neck pain. And it's considered a last resort treatment because it does involve surgery. It's very expensive for the insurance companies. And it doesn't fix the problem, but it masks pain nicely. Now, it's not a first-line treatment, right? It's a last resort. It doesn't fix a chronic pain problem. It's a proverbial Band-Aid. But if a person does not have a surgical option for their condition, then what are they going to do? Just keep taking more and more and more pain medication? Or something like this can really be beneficial. It's good for failed back or neck surgery syndrome, postlaminectomy syndrome, RSD, diabetic or peripheral neuropathy, and then things like testicular, pelvic, or abdominal pain that has not responded to conservative treatments. Now, what can it do for chronic pain? It can take somebody who has chronic pain, depression, disability, inability to work, and it can completely turn their life around. It does work well for back, neck, arm, or leg pain. Initially, you need to have a trial placed. I'll talk about that in a minute. It's an excellent last resort option if surgery is not indicated and the person lives with daily pain. It can decrease the need for narcotics exceptionally as well. So the trial implant is the first phase. It's percutaneously placed under sedation, not general anesthesia. It involves two tiny leads that go underneath the skin with a percutaneous placement, and then there's a sterile dressing, and then the leads go into an external battery pack which has all the programming options. So the pain doctor will put the leads in and then say to the patient, they'll turn it on and then say, does that cover the area where you have pain on a regular basis? That's why the person needs to be awake, so they know the placement is correct. After 5-7 days, it's taken out in the office. If the pain relief was 50% or greater, then the indication exists for a final placement, and then the only thing left is a psychological evaluation the insurance company requires. The final stimulator is placed under general anesthesia. It takes about an hour. Consists of these large paddle leads for better coverage as opposed to just slender electrodes. It has a paddle-looking lead on the end. It does require a larger incision with some bony removal so that you can get the larger paddle lead up around the spinal cord. Then you take the leads and you tunnel them subcutaneously under the skin for placement of this battery pack, which also has the programming in it, and so that way everything's under the skin. Okay. The newest ones have over 200 programming options, which is amazing, and they're rechargeable through the skin, so you don't have to take them out. And the newest ones also have coverage as a person goes from a sitting to a standing position. The older ones, often the person had sort of a jolt of electricity or pain. That doesn't happen anymore. How well do they work? There's been a lot of studies done on their effectiveness. One sponsored by St. Jude showed that 84% had life greatly improved. 77% good to excellent pain relief in a neurosurgery study. Diabetic neuropathy patients, 85% experienced substantial sensation recovery, and over 3/4 have significant pain relief. So they're great for neuropathy. And for RSD, spinal cord stimulator work extremely well for pain relief, especially if it's done within the first 2 years. So you can see how small these batteries are now with the programming, about a little over the size of a quarter. Here's what the paddle leads look like, okay? That's why you need to take a little bone out when you're putting those in around the spinal cord. So the risks, the device could stop working well, may have to be replaced, or programming options could be changed. They can migrate. They may get infected. Could be some bleeding, and there's sometimes some wound breakdown. The top non-operative pain management in the state is through the Washington Pain Network. There are several clinics throughout Washington with over 50 insurances being accepted. Over 25 treatment options are available for all types of pain conditions, and the average success rate exceeds 90% with the board-certified award-winning doctors. Visit us today at washingtonpainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the Washington Pain Network. Your pain stops here.